We're going to continue talking about pharmacology, and we're going to focus on certain drugs that affect the central nervous system. The central nervous system is made up of the brain and the spinal cord, and the two classes of receptors that we'll talk about now are the GABA A receptor and the glutamate receptor. And in the following lectures, we'll talk about the opioid and the dopamine receptors. For now, we can say that certain medications that stimulate the GABA A receptors helps to potentiate the entry of chloride ions into the cell. And by the entry of chloride ions into the cell, this generally stabilizes the cell membrane due to the hyperpolarization or the lack of depolarization within the cell membrane. So clinically, that would have an effect of sedation or the reduction of anxiety, or perhaps even a hypnotic effect on the central nervous system. Opposed to the glutamate receptor, which once stimulated, helps to allow the ions, for example, sodium and calcium, to enter into the cell, and allows the exit of potassium, which helps to depolarize or stimulate the cell membrane and therefore increases the excitatory or stimulation within the central nervous system. So therefore, these two receptors have opposing effects clinically. The GABA A receptor, by potentiating the entry of chloride ions into the cell, has an inhibitory effect or sedative effect on the central nervous system, and the stimulation of glutamate receptors, allowing sodium and chloride to enter into the cell, as well as potassium exiting the cell, creates an excitatory effect clinically on the central nervous system. And we can see this depicted, for example, if you were to look at the reticular activating system, which is shown here as RAS, which is thought of as being a diffuse collection of brainstem neurons that's involved with the arousal behavior within consciousness. And certain receptors, such as the GABA A receptor, that allows the entry of the chloride ions into the cell and therefore stabilizes the cell membrane and prevents the activation or depolarization of the neurons that are going to the cerebral cortex. This inhibitory effect of the reticular activating system generally produces some type of sedative hypnotic effect or an amnestic response within the central nervous system. And certain classes of medications such as barbiturates, benzodiazepines, propofol, and etomidate can stimulate the GABA A receptor and therefore produce some degree of sedation. Versus glutamate as a neurotransmitter that stimulates the glutamate receptors, for example, the NMDA receptors, and therefore allows the entry of calcium and sodium within the cell membrane, passing through the cell membrane, that stimulates the neurons that are coming off the reticular activating system, and therefore this diffuse spread of neurons going to the cerebral cortex will generate an excitatory effect on the cerebral cortex and therefore create an arousal effect or an activation of the central nervous system. So we'll talk about this in greater detail, and we'll talk about each class of medication that stimulates the GABA A receptors, for example, barbiturates, certain medications like thiopental, certain medications like Versed or midazolam, lorazepam, and diazepam, which belong to benzodiazepines. And we'll talk about propofol and etomidate in greater detail in regards to the induction of general anesthesia. Another IV induction agent is ketamine. And ketamine actually works to inhibit the excitatory receptor of glutamate, more specifically the NMDA receptor, which is an example of the glutamate receptor, and this inhibitory effect on the excitatory bundle of neurons will create a dissociative amnesia, which is characteristic of ketamine. We'll talk about this all in greater detail in the next lecture, and we'll talk about the pharmacokinetics, the pharmacodynamics of each of these medications, and we'll talk about the excretion and the clearance as well in greater detail.